This is Dr. Daniel Paul, orthopedic surgeon with Easy Orthopedics, and today we're going to talk about how to keep your wound from getting infected. If you like this video, we put out new content weekly, so please like and subscribe. So maybe you got a wound, maybe it's a surgical wound, maybe you scraped it and you really don't want to get it infected, which infections are bad, you don't want them. So how can you prevent that? Well, it depends on the wound. So let's say it's a surgical wound, so it's put on in a clean environment, meaning that no dirt should be in there, hopefully not. The way to do it is to keep it covered, meaning that you don't want it to be touching outside areas of like the environment. And that can be certainly worse if it's on your foot where it's like sweating in a shoe or somewhere else like on your hand. So normally there's surgical dressings that are covered up, and then once those surgical dressings are off, which is sometimes in a few days, sometimes longer, you kind of keep it covered up for at least 2 to 3 weeks until that wound is really healed. And then once that wound is healed, then you should be able to interact with the environment without getting infected. This also means while it's healing not to go in any standing bodies of water, because water and bacteria can get in and that can cause an infection. So you got to avoid your like pools and like hot tubs and like certainly lakes and things like that. Showers are normally okay depending on what your surgeon says when you're rinsing it with soapy water. You also don't really want to be rubbing any lotions or anything on it until after it's completely healed, because that can cause stuff to get in and cause it to be infected. Now, let's say it's not a surgical wound and it's like a scrape. Well, it depends on how deep the scrape goes and how dirty it was. So if it's just a superficial scrape, honestly, you've probably been doing this most of your life, just cleaning it. Sterile water is good. If you don't have that, you can always boil water and let it cool down and use that. Or you can use betadine or something like antiseptic. And then also you can put a triple antibiotic on top and just keep it covered up until it looks like a superficial layer of skin has grown over. That's sort of your best bet. Once they get deeper, it can be a problem, especially if it's really deep, meaning bacteria might have been pushed in there. And in that case, there's not a whole lot you can do, and it might just get infected anyways. Sometimes antibiotics are good in these times to prevent an infection, but sometimes if they're that deep, the wound just needs to be cleaned out thoroughly. If it's really deep, then sometimes that needs to be done in the emergency room, in the operating room, so you can be asleep while they clean it out, and then just use of antibiotics afterwards. Most people don't need that. Again, superficial wound, you can kind of clean it, sterile saline, betadine, clean it all off. Make sure you don't leave betadine on your skin. Make sure you rinse it off. Triple antibiotic, Band-Aid should be good. Deeper stuff, really got to clean it out well. Definitely use sterile saline for that. And then cover it up. If it's really deep and dirty, then you might have to get it cleaned up in the operating room. Because if it doesn't get infected, you're going there one way or another. So I hope I was able to answer your questions about how to keep your wounds from getting infected. If you have any questions I didn't answer, feel free to leave them in the comments below and I'll do my best to respond. But I can't give you any specific medical advice because this video and all my videos are for educational purposes only. Thanks for watching.